Hello, my name is Riley Joyner, and today I'm going to be giving a presentation on why speech language pathology and audiology have science within them. So my current career goals. So at the moment, I'm hoping to become an audiologist or speech language pathologist, but today my presentation is going to be focused on audiology. So to become an audiologist, I'm going to need to have a degree in communication sciences and disorders. And I intend to get my doctorate in order to become an audiologist, and also I will need to complete 8 to 10 years of schooling. So as an audiologist, I will be testing individuals for hearing loss. So a lot of times individuals develop hearing loss over a long period of time, or they're born with hearing loss, and the goal of audiologists is to basically assess how much hearing they have left and just other stuff like that. Basically just test their hearing. And then also I will need to diagnose individuals with hearing loss, help people who are having issues with balancing, and help individuals who suffer with hearing loss to communicate. So as far as balancing goes, a lot of times in your ears, if there's some sort of trauma or something, it can affect the way that you balance, because there are lots of components in your ears that have to do with that as well. And then as far as communication goes, it is called a degree in communication sciences and disorders, and hearing does have to relate with communication. And oftentimes people who are deaf or hard of hearing are actually unable to communicate efficiently. So as an audiologist, I will be working to help them communicate as efficiently as possible. So as far as science goes in audiology, a lot of audiologists use scientific method. So this might seem kind of odd, it doesn't really make any sense, but the scientific method can actually be very important when it comes to diagnosing individuals with hearing loss. So you're going to have to use the evidence that you gain, you're going to have to create a hypothesis, you're going to have to draw conclusions from the evidence you gain to basically assess the patient and what their hearing loss condition is. Then I'm also going to need to be well versed with my anatomy, especially when that comes to the ear. There are lots of tiny bones and pieces of cartilage and lots of canals that I'm going to need to memorize in order to be able to effectively help my patients hear. And then also there's heavy importance when it comes to genetics, because lots of hearing conditions can be passed down genetically. And not all of them are, but some of them can be. So it can be important to know things like Punnett squares and stuff like that, just so I can really track the genetic line. So our course, we did learn about the scientific method at the beginning of our course, and I learned how to efficiently utilize it during that first module. And this may be beneficial when I need to diagnose individuals with a hearing condition, because as I previously talked about, it can be important just when it comes to gathering evidence. So a patient may tell me that they're having ringing in their ear, or trouble balancing, or they can hear some things but not others, like when someone's really close or someone's really far away. So it can be just really important to basically be able to absorb those symptoms so I can fully just assess their hearing loss and stuff like that. And then also, as I previously talked about, genetics can be important because there are certain hearing disorders that can be passed down through generations. This can be important because I might need to know if a disease is autosomal recessive, or whether their deafness comes from which side of the family. So it might just be important when it comes to that. And then in conclusion, I learned that science is incredibly influential within audiology. And I also know that is referred to as the science of hearing, which has science in the name, so it kind of just points to the fact that science is incredibly important. And then moreover, I was surprised to learn that it is the format of science experiments and projects that is the most important practice to take with me throughout my career. So again, as I said before, when I'm diagnosing patients, I'm going to need to use that scientific method to just gather those pieces of evidence and draw conclusions that are reliable and correct. And then overall, I will need to remember the things that I've learned in this class in the future to be successful as an audiologist. So I'm going to need to take a combination of everything I learned in this class to basically find success as an audiologist. And I just think it's really important because I'm going to need to use all of the stuff I've learned here as a foundation for the stuff I'm going to learn in college, because I'm probably going to go into more depth when it comes to the anatomy, genetics, and maybe even the scientific method. You never know. But overall, I am going to need to use all this, and I'm thankful to learn it now so I can be ready when I go to university. Thank you.